Honourable Member of Calgary-Fish Creek, followed by Edmonton Riverview.
Thank you, Mr. Speaker. Mr. Speaker, yesterday afternoon, this government confirmed what most Albertans already suspected. This government has absolutely no idea how it will pay for its costly campaign promises. I asked for the nitty-gritty on how much their 140 family care clinic promise would cost. The health minister responded, the costs are unknown. Well, Mr. Speaker, they weren't unknown when they said the campaign platform was fully costed. They weren't unknown when they said it would come from in-year savings. They weren't unknown when they said it would come from the existing budget. To the Minister of Health, are you really now saying you have no idea how much it will cost Albertans to keep this promise? And why weren't you upfront about it when you made the commitment?
Mr. Speaker, the ability of the honourable member to rephrase previous questions in a way that would seem to suit her purposes never ceases to amaze me. Mr. Speaker, in written questions, the honourable member asked for standardized costs relating to various aspects of family care clinics. And as I explained to the honourable member, and as I hope she would understand as a result of the election campaign, this government is leading a number of improvements in primary health care delivery across the province. Mr. Speaker, these improvements are focused on analysis of community health needs. They are focused on allowing communities to participate in developing plans to meet those needs. And, Mr. Speaker, they will be unique plans that respond to their particular situation.
Honourable member.
Given the $3 billion hole that our province is falling into, your unwillingness to discuss health economics, that's your words, and the fact that you haven't looked at the cost effectiveness of what were supposed to be our three pilot projects, how can the Minister of Health have us believe that hundreds of millions, perhaps billions of dollars that will be spent on family care clinics will be money well spent?
Well, Mr. Speaker, the first flaw in the honourable member's logic is her assumption that we are going to simply spend new money in order to achieve our objectives to improve access to primary health care across Alberta. What, in fact, we are doing, Mr. Speaker, is, as I explained in an answer to one of her questions yesterday, is we are looking at existing resources that exist across the province in the form of physical infrastructure, in the form of teams of health professionals that deliver care, in the form of clinical protocols and processes and programs that they have developed to support Albertans, for example, living with chronic disease, to see how we can reorganize those resources in order to deliver a better product. I would expect that as a member of the party opposite, she should be very interested in that.
Honourable member.
Given the lack of trust that this government has sown with the doctors of our province, as evidenced by their new full-page advertisement, and given the lack of trust Albertans are feeling with this government over your broken promises, will the Minister of Health please tell the Assembly the cost of the family care clinics?
Honourable Minister.
Mr. Speaker, this government, as was committed in the answer to the honourable member's written questions and as we've committed to before, will provide the costs of individual family care clinics as they are rolled out. We will also, Mr. Speaker, disclose to the House the cost of enhancements that we will be offering to primary care networks in order to further the very important work that they do. Mr. Speaker, if the honourable member opposite wants a cookie-cutter approach to primary health care in Alberta and she wants to impose a model of care on particular communities that's tied to a standard cost, she's welcome to go out and market that to Albertans, Mr. Speaker.